Hi, my name is Martin Livingstone. Student ID is 0969116, part of the Contemporary Intensive Care Paramedicine course at AUT. Today I'm going to demonstrate a ETT placement on this patient here. What the indications are for ETT placement is to ensure that first of all, the patient's a GCS of 3 and they've got ineffective breathing, basically. So that's what we're going to try and do. So before we start, we're going to have a look at mnemonic that we use, which is lemon. So we're going to look at the patient first of all. So the actual physical stature of the patient. So we're going to look at all the features of the face. We're just going to make sure that there's not an enlarged tongue and there's no protruding teeth or anything in there. And we're going to look at the neck mobility, whether or not they've got a short neck, because that can make a difference as well. And just looking for obvious signs of bleeding as well. Obviously, if it's a spinal patient, then we'd need to watch that as well. We're going to evaluate the patient for the correct size to enable us to use our equipment to get in there. So we use the 3-3-2 method. Basically 3 fingers in, 3 fingers across where the incisors are, and 2 fingers ideally where the sort of mandibular and larynx spaces as well. So we'll look at the visibility of the actual structures as well using the Mallampati. So once we're in there, we'll have a good look at the esophagus and the areas of the mouth themselves, just to ensure that we've got a good visibility going in there. We're looking for any obvious obstructions. Obesity comes into it as well, because they can have narrower airways in comparison to their facial features. And we're looking for neck mobility in itself, because this mobility, the limit of the ability of the position of the head effectively. Because ideally what we're wanting when we do this is we're wanting to get the head into a sort of sniffing position, a sort of forward sniffing position. And enabled us to do that, we use a towel. So we can get the towel in under the head, like so. Get it into a good position like that. Make sure the airway's open, but make sure that we've got a good sniffing position there also. We want to make sure that we're prepared just in case. We've got all our equipment here. We've got all the gear. We'll test the ET tube first of all by blowing it up, just to make sure that the balloon on the end there is firm and it stays there, which it is. So then we'll deplete that. While we go over that, we consider the failed intubation drill as well. So ideally we're looking for 15 seconds to visualize the chords themselves. By the time of 30 seconds comes, then we should have the ETT tube in place as well. If it fails and we can't get the ETT tube in, then we may use a bougie and put the tube over the bougie and do it that way. Again, if that fails, then we could consider an OPA, could consider an LMA as well. If we're unsuccessful with that due to trismus and it's life-threatening, then we may consider a crike on here as well. So we've got the scalpel and everything in place there. So what we're going to do here is we're just going to pre-oxygenate the patient first of all. So we're going to get the bag mask. We're going to, once we've normally got the mask on here, so what we're going to do is we're just going to get enough oxygen in there, because we want to get hemoglobin saturation as much as we can. And what that's going to do is just to minimize the amount of desaturation that may go while we're trying to get that ETT into placement. If it falls below 70%, then obviously there is a risk of dysrhythmias, potentially hypoxic brain injuries leading to death as well. So without much further ado, we'll get on with this. We'll get the laryngoscope in there. We'll have a good look. We'll get it down, right down as much as we can. We'll get it into the vallecula. We'll have a look and we'll see if we can visualize the chords. So we've got a good chord view there. So just going to go in with the ETT tube now. Just going to slide that in. We're just trying to place it just past that second one there. Just going to take that out. blow the balloon up with the syringe that we had already prepared. And then what I like to do first of all is just check it with the balloons going up there, as you can see. So we're quite happy with the placement of that. So we'll get the filter on. We'll get the filter on with that. Get the end tidal on. Get the old COBS connector on. And then we'll get the bag mask in place. So that's going up there nicely. And then what I'll do after that, after I've done all that, is I'll get the Thomas tube holder and get that into place. And we'll get that in place. Good. So as you can see, we've managed to get a good airway into this patient, a good secure airway, which is going to help us with the potential later on for securing a much better airway. Thank you.